If you have ever heard somebody say something to the effect of, oh no, I hardly ever drink, maybe once or twice a year, but when I do, I make it count. I know I've heard similar things from patients over the years. Most of the time, these patients think that because they're not an alcoholic or that they don't drink on a regular basis, that they're safe from many of the detrimental effects aside from a slight hangover. But this actually couldn't be farther from the truth, and that brings me to what is called the holiday heart syndrome. Also, if this is the first time we're meeting, hello, my name is Stacy. I am a paramedic instructor, and on Tuesdays I like to highlight something cardiac, whether it be a rhythm or a condition, some type of anatomy or something. So today we're talking about holiday heart syndrome. So first, taking a look at the name, when do people typically binge drink? Usually it's on the weekends, holidays, celebrations, and over the years there has been a link or a correlation noted between those times and the increase in cardiac dysrhythmias in the hospitals. And the most common dysrhythmia that we associate with it is atrial fibrillation. There are other dysrhythmias that can be associated with binge drinking, but that's the most common one. And it is definitely one that I teach paramedics to look out for the most. Is a lot of times you'll get young, healthy individuals that just drink a ton, whether it be due to a St. Patty's Day celebration like this guy, or they just graduated, or they're on vacation. Suddenly, after drinking a god-awful amount of alcohol, they have chest pain, difficulty breathing, maybe they feel palpitations or fluttering in their chest or something like that, and they can hook them up to the cardiac monitor, and oftentimes they will be in atrial fibrillation. If you've never heard of atrial fibrillation or ever seen it on a strip, this is what it looks like. And it essentially just means that the top chambers of the heart are not squeezing or contracting like they're supposed to. They're just quivering. And so if you look at where that arrow is pointing, that's what we call the QRS complex. In a normal sinus rhythm, the distance between each of the QRS complexes is going to be equal. It's going to be the same. So that's what we call regular. But in atrial fibrillation, you can see some distances are shorter, some are longer. And so it is an irregular rhythm. And just because the correlation was made between binge drinking and the sudden onset of cardiac dysrhythmias or other heart problems, doesn't necessarily mean that it always shows up right smack dab in the middle of drinking. It can actually show up when the hangover kicks in or the next day. So as an EMS clinician, would we ever see this? Absolutely, we could see this. And it may just come in the form of a patient calling from their house or their hotel room or what have you, where they've drank all night and now they're just getting up and around and they're starting to feel those hangover symptoms, which are typically normal, of a headache, nausea, and vomiting, but now they have more concerning symptoms like difficulty breathing, palpitations, or chest pain. So if we're treating this patient on the way to the hospital, we are 100% going to want to monitor vitals, get them hooked up to the cardiac monitor, look for any dysrhythmias, and treat their signs and symptoms. Typically, a hungover patient is going to be dehydrated, so we can address those concerns. So does this mean that if we have a young patient that trips off into atrial fibrillation after binge drinking, that they are always going to suffer with atrial fibrillation for the rest of their life? Most likely, no. They're not going to have to prepare for a lifelong atrial fibrillation diagnosis. But the fact that they did trip off into atrial fibrillation after heavy alcohol consumption can indicate that they will do it again. And this is most likely partly responsible for the shift. And this shift is one that I've noticed since I've been in the medical field, and it hasn't even been that long. From, oh yeah, have a glass of red wine with your dinner, it's really good for your heart, to absolutely no alcohol is safe. Alcohol is a poison. It does horrible detrimental things to your heart and your brain, and you really don't hear a lot of doctors advocate for it anymore.